Hi, my name is Jenny. I'm 53 years old. I live just outside of Chicago. I am a police dispatcher. I've been doing that a little over 18 years, and I've been on Orenitram since July of 2020. Before I started my treatments, I was always short of breath. I couldn't walk even short distances without having to stop to catch my breath. I was always nauseous and vomiting. I did start on another treatment which improved my symptoms significantly with being able to walk further distances without having to stop and be extremely winded. But I talked to my doctors, asked if I could go on to a pill form, which would have been a little bit more convenient for my lifestyle. Since starting Orenitram, my PAH symptoms have improved. I can walk further distances. I'm not as short of breath all the time. When I started Orenitram, my team put together a schedule for me for my doses each week that I'd be titrating up. So it kind of gave me a roadmap of how my journey was going to go. So each week I could look at the sheet, I would know what doses that I would have to take, and where eventually I was going to end up at my final dose. The point of titrating on Orenitram is you start out at a low dose because your body can get adjusted to it and get adjusted to the side effects of the drug. So you start slow, you start low, and you work yourself up until your body gets adjusted to the dose that they want you to be on at the end. So it took me about 5 months before I got to my target dose of 3 milligrams. In the beginning, when I started, the lower doses were a little easier for me. And towards the middle is when it started getting a little bit harder. But now that I'm fully titrated at 3 milligrams, I'm doing really, really well with it. When I was in the middle of my titrations, when I would experience any leg pain or nausea, I'd work with my healthcare provider. They would prescribe anti-nausea medications and gave me some suggestions on some pain relief for me. My doses for when I'm taking Orenitram, they suggest every 8 hours in between the doses. So my first dose, I usually start around 4:30 a.m. when I first get up to go to work. My second is around lunchtime, around 12:30, and my last is 8:30 when I go to bed. I usually set an alarm so I don't forget, and I try not to vary too far away from it. One thing I learned for me when I started learning about what kind of foods I needed to take with the Orenitram, I kind of got a lot of suggestions from a support group on a social media page that I follow, and also some suggestions from my doctor. And protein shakes really work for me, especially in the mornings when I'm not hungry yet for breakfast. And I always keep a protein bar in my bag with me everywhere I go, so I'm not without something. So protein shakes and protein bars are pretty much a standard for me to always have with me. One thing I've learned when I started this is maybe have a day planner or a journal with you and write down how you're feeling each day, what effects food has with you, and what maybe might cause you to get nauseous or cause any discomfort, so that you can, when next time you have a doctor's visit, you can bring up these concerns and you're not the last minute you forget what you were going through.
Important safety information for Orenitram. Who should not take Orenitram? Do not take Orenitram if you have severe liver problems. What should I tell my healthcare provider before taking Orenitram? Tell your healthcare provider if you have liver problems or diverticulosis. If you are pregnant, breastfeeding, and/or plan to become pregnant or breastfeed. It is not known if Orenitram will harm your unborn baby or if Orenitram passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with Orenitram. About all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Orenitram and other medicines may affect each other, causing side effects. Do not start any new medicine until you check with your healthcare provider. Especially tell your healthcare provider if you take another medicine that contains treprostinil, such as Remodulin or Tyvaso. How should I take Orenitram? Do not change your dose or suddenly stop taking Orenitram without first talking to your healthcare provider. Orenitram is usually taken 3 times a day, about every 8 hours, or 2 times a day, about every 12 hours. Your healthcare provider will tell you how often you should take Orenitram. If you have side effects, your healthcare provider may tell you to change your dose or when you take Orenitram. Take Orenitram with food. Swallow Orenitram tablets whole. Do not split, chew, crush, or break your Orenitram tablets. Do not take Orenitram tablets that are damaged or broken. If Orenitram tablets are not taken whole, they may release too much medicine at one time. This can lead to side effects. If you miss your dose of Orenitram, take the missed dose as soon as possible with food. If you miss 2 or more doses of Orenitram, call your healthcare provider to see if you need to change your dose. If you take too much Orenitram, call your healthcare provider or go to the nearest hospital emergency room right away. You may see the tablet shell in your stools, bowel movements. This is usually normal. The tablet shell is not digested. If you have diverticulosis, the tablet shell may get stuck in a blind pouch or diverticulum in your intestine. What are the possible side effects of Orenitram? Orenitram can cause serious side effects, including worsening of PAH symptoms. Stopping Orenitram suddenly may cause worsening of your PAH symptoms. Do not change your dose or suddenly stop taking Orenitram without first talking to your healthcare provider. The most common side effects of Orenitram include headache, diarrhea, nausea, vomiting, flushing, and pain in arms, legs, and jaw. These are not all of the possible side effects of Orenitram. Tell your healthcare provider if you have any side effect that bothers you or does not go away. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. What is Orenitram? Orenitram is a prescription medicine used to treat pulmonary arterial hypertension, PAH, which is high blood pressure in the arteries of your lungs. Orenitram can help slow down the progression of your disease and improve your ability to exercise. It is not known if Orenitram is safe and effective in children. The risk information provided here is not comprehensive. To learn more about Orenitram, talk with your healthcare provider. Please see full prescribing information and patient information at www.orenitram.com or call customer service at 1-877-UNITHER, 1-877-864-8437.